Hello, everyone. Welcome to Click Moments, where the right information at the right time is a portal from where you are to where you want to be. And I'm really excited about today because we have Dr. LaShanda Brown here, who is a holistic and functional medicine practitioner. And we're going to have an amazing discussion today because we've both been talking about how functional medicine and taking care of our bodies has been an instrumental part on both of our journeys to being the authentic version of ourselves. There's this space in between awareness and actually walking into taking care of your health that is a really instrumental part, and our conversations have really enlightened me about some of the areas that I need to be mindful of. So we're gonna just riff and have a conversation today, so welcome.
Thank you.
So I'd like to start with, there is this moment where we start to become aware that we need medical care. And when we're seeking medical care, oftentimes there can be this real expectation of going in and having somebody else, a practitioner, fix something. And I'm sure you see people walk in the door with that kind of mindset. And I'm wondering how you approach that collaboration when you're working with somebody as they're coming in and they're really looking to improve their health.
Essentially, what we're trying to do, those of us who are kind of approaching this health management as a holistic, collaborative approach, and patient-centered is the latest buzzword of how we're working with patients, is letting the patient be the center, or at least a major part of the decision-making process. But what has to happen behind the scenes for that to happen is we have a system set up for emergency care, for symptom management. And so people have been trained for hundreds of years now to come in with a symptom, and our systems have been rewarded for treating symptoms and curing acute illness, so that now we're trying to turn the ship, and it's happening kind of slowly. So these kind of conversations are important because we've all got to realize the part that we play now in the new direction of healthcare in our country. So holistic healthcare, holistic approaches, and especially functional medicine feel like buzzwords, and they feel like a new trend right now, but it's actually a new direction that we're going. It's going to require a lot of responsibility on both the part of the provider and the part of the patient.
Yeah, that's interesting because I would imagine that you get some people that come in that really want you to fix them.
Yes.
And then you get other people that are coming in that it's almost like, I heard you recently talk about how people will come in and they'll be like, I'm fine.
Yeah.
Right? And so there's this individual desire to be okay.
Yeah.
That sometimes comes out in a medical office, and it can be counterproductive to somebody actually becoming well. So I would imagine to a certain extent, it's a challenge to get people to really tap into what they actually are feeling. So do you have kind of like some discussions with people around that? Because you're asking them sometimes to have skills that they may or may not have.
Yeah. I don't actually have discussions with them. Mostly because in this time-limited encounter, I've got to get all the information I can. So it's not really the right time to educate them. But what I'll do is ask lots of questions. Especially, I notice this with my men of a certain age. You ask them how they're doing, and they're like, I'm fine. Everything's fine. And if I'm lucky enough to have a partner, a best friend, a child in the room, they're in the back going, no, they're not. And they're filling in the blanks. And so I'll redirect the question back to that patient again, the person who's at the center of this conversation, and say, okay, yes, I know you're strong, but how are you really? Tell me what it's like from day to day to be in this experience, to have this symptom, to have this whatever. And then you get people to open up because they know that you genuinely care about their lived experience and not just the actual symptom. I'll ask them, say they come in with pain. Anxiety is really more typical of what I deal with on a day-to-day basis. They come in with anxiety. They come in, they want the pill, the fix, the cure for the anxiety. But then I'll start to ask questions to pull out the rest of their lived experience. How is this affecting your relationship? How is this affecting your sleep? Are you able to eat, or are you stress eating? And so we start to pull in all the things that really lay out a different picture of whether you're fine or not. You're not actually fine if you're having to self-medicate with alcohol, or if you're not getting sleep and now your whole cardiovascular system is triggered and inflamed, and you're having higher blood pressure and sleep apnea and all these different kinds of things that are connected to your complaint, your one complaint that you brought to the table today. So I become like a detective. That was what I loved about nursing in the beginning. It's like, ooh, I'm like a detective. I get to go on this mission to find where's the root, what's really going on. And that's what functional medicine is about. It's about finding the root of what's causing the symptom that this person is here to talk about. So I might be here to say, I'm having anxiety, I'm having panic attacks, and it shuts down my whole day, right? That's what brings people to the doctor's office. Something strong enough that it impacts their day. Through a series of conversations, I may not get at that initial conversation, but through a series of conversations, I might discover that the root of their panic and their anxiety is a trauma from when they were 5. Or it's a relationship they've been in for 25 years that is draining the essence and the life force out of them. We got to get to those conversations, because no amount of Xanax is going to fix either of those things. They're still going to be there running the script in the background, and we have to deep dive and dig in and figure out what's really going on.
Thank you for bringing this up, because I feel like this is such a critical piece. Like, you know, it depends your framework and your expectations. So people can actually enter into the healthcare field and want a practitioner who actually just gives them a pill. And it is like, that is actually no judgment. Like, that is a framework which people can come in. But I would think then that a functional medicine practitioner is not the person you want to go to necessarily, right?
Right. And they're also not the person you want to go to when you have a broken leg. So there's going to be a place in the sequence of things where you seek different types of practitioners. So if I am having full-blown panic attacks, I'm going to need a Band-Aid until I get to the other side and I'm able to do, like, I can't even do the work while I'm in crisis mode. My body's in crisis mode.
Yes.
If I have a broken leg, there's no need to go investigate what's happening in my gut and why I'm having more falls than usual. And I got to cast up the broken leg and get it healing. Then, unfortunately, that's where the conversation stops for a lot of people. They don't go back into the system because the system is there to treat the acute illness. We need a system and more conversations happening where now, you know, if you have a broken leg because you've been more reckless, because you lack focus, because all these other mental processes happening, eventually we got to talk about that, right? Or else you'll be on your 4th broken leg in 4 years and we're just like, oh, well, that person's just clumsy.
Great point.
Maybe not.
Yeah, great point. And I appreciate, like, so I actually have had anxiety throughout my life, and I was really, it benefited me to have a physician that wasn't willing to give me traditional anti-anxiety medications, in part because they knew that I was somebody who did not like to take medications. So what we entered into through our collaboration was understanding that I preferred to try. It was not, I would be willing to try medications if, when I tried to do things on my own, they weren't working to handle it. And so the way that I approached it is I worked with my physician, as well as I became a student of holistic ways to, like, how does one manage anxiety without medications? And I wanted to take the social responsibility to be able to take that on and see how far I could go with that. So I looked at things like sleep and making sure that I was getting an adequate number of sleep, number of hours of sleep in a night, and healthy sleep, like actually sustained sleep, right? Not broken throughout the night, working on that. Looking at the foods that I ate and really trying to be a student of how, when I eat these types of foods, does it affect and supply my body? And then making sure that I'm paying attention to, like, caffeine at night, not doing it too late to be able to sleep. Looking at all of those different types of holistic things, that is certainly like a lens. And we've talked about this before. I use the term social responsibility, use a different term, which I really value. But I'd like to talk about a little bit about what that looks like with how far you see people in certain conditions like anxiety being able to go on their own in order to manage certain symptoms.
So let me explain it by telling you my story in like my click moment. In my early 30s, I went through a phase where I was it started with gallstones. The gallstones back up. They caused some inflammation in my pancreas. And so then I had this series of pancreatitis. I'm in the hospital for a week at a time, 2 or 3 times in a year. And this would happen for a couple of years in a row. In that time, I had 2 major surgeries to remove this cyst that had grown on my pancreas. My splenic duct was like all of my enzymes were just all convoluted and decaying in a way. And so I'm having to have major medical interventions. And at the end of my second surgery, weaved in, I just had a C-section. So I had a baby and I've got a surgery and I've got this tumor growing and I'm having a lot of pain a lot of the times. In my follow-up appointment for my second surgery, I looked at the surgeon and said, how do I not see you again? Like, this is not fun for me. I don't want to come back and because at that point I'm on track having surgery every couple years and nobody has given me a solution. Everybody has been there to patch things together and sew things to remove this precancerous tumor. And I'm so grateful for that.
Right.
But none of them had the language or the lens to say, now this is how we keep you from coming back. And so I asked that question because I'm just exhausted. I don't want any more emergency room trips, no hospital stays where I'm IV, nothing by mouth for 7 days. Like all of that, I'm over it. And his answer was, there's really no cure for this. Like this could possibly happen. I can prescribe you some enzymes to help you digest your food better. And all of me just went, no. That was my click moment. When I hit that point where I was just like, there has got to be another way. I don't know what's on the other side of this. I don't know what my next step is, but this is not it. I know there's some authority I can take, personal authority. That was the word we're talking. There's some role that I can play in this. Now that's very different from being in that either judgmental place or victim place where I'm just like, this is how I'm made. I'm a person with chronic pancreatitis. I'm just gonna be in the hospital. Because that's the bucket we put folks with certain labels in. But somewhere in my system, I thought, no, I'm gonna find another solution. So I went on a path similar to what you were describing with the anxiety. What are the foods? I attended a food as medicine conference. What are the foods and the food combinations that help cure certain conditions? People are having those conversations about food and our food chain and the quality of the food that we eat.
Yeah.
And then that took me to another step. And I found yoga and I became a yoga teacher. And so I'm now focused on spiritual growth and mind-body connection, and I'm growing that part of me and my piece of the puzzle. So from that point on, when I come to like fast forward 8 or 10 years, when I go into my primary care doctor, I can say I'm having some discomfort and some digestion issues with my body. I didn't wait until I was in a full-blown pancreatitis flare-up. It's like, this is coming. I feel it coming. Can we at least do some labs to check it out to make sure I'm not already in crisis mode? But what else can we do? And we start having conversations because I know I'm not going in saying, I've got a bellyache, I'm having cramps. I knew exactly what was going on with my body because I was starting to have conversation with my body and really investigate. And I can look around then at what's going on around me and I can say, oh, I'm doing a little too much volunteering. Oh, I'm not asking for help at home. Oh, I'm not digesting a truth that is happening in my world and my body is telling me.
Yes.
That's a different relationship with your body and listening to the mind and the conversations and being tapped into spirit and feeling the balance and the synergy between those.
Okay.
That's the functional medicine approach.
Yeah, I like this. So, you saying that really hit me. Like, I remembered that my physician actually did try to give me a medicine, but it was a medicine that I didn't want to take. And I said, that's like, they wanted to give me like an antidepressant that had an anti-anxiety agent in it. And for me personally, that didn't resonate because I wasn't depressed. Okay. And maybe I was. Maybe I was, but I had taken an antidepressant many years before and had a not so good experience over a long period of time. And so I was reluctant to start there. I was willing, I didn't feel like it was severe enough, my depression, that I was at risk of anything bad happening. And so I was like willing to try something else before I jumped to that, right? But what I heard you say and really resonated with me was, you got to tune to your body. So that moment that you were like, that doctor, like some of us can look at that moment with a doctor when they said, well, there's really not much we can do. Some people would get really depressed and be like disempowered. But instead there was some part of you that said, this is an invitation to, yes, I may feel this sadness, this depression, this moment of acknowledging, oh gosh, things are really bad. I'm going to have to take personal control of this. I'm going to have, I think you use personal authority, which is such an empowering word, by the way, when you say that, personal authority. I love that. So I get to be empowered in this. This is not something done unto me that I'm coming to somebody else for, but I'm going to have to dig in and figure out, how do I get out of this? How can I make this better? And I do think, for me in particular, and it sounds like to you, there is a spiritual component to that. You're tapping into, or I'm tapping into, or we as individuals are tapping into a part of ourselves that knows something from a bigger lens that's beyond us, that we haven't been privy to have access to up until now. It's like we've been so embedded in life that we've been disconnected from our bodies, and we're in this state. We're part of this. But then that moment where you're like, I have to either dig in and find some personal solutions for myself, or I'm going to have to accept a reality that scares the heck out of me. So I think I'd like to talk a little bit about that tapping into, like what that feels like to you, because I bet there are people out there that are facing some sort of medical condition that they don't know where to begin. And what does it look like when we tap into this spiritual or this infinite part of ourselves that has the capacity to have more solutions than what we currently have access to? What can you remember or talk about that moment for you?
I'm going to run with the analogy, the metaphor you just gave of like tunnel vision versus big picture. I think that sets the frame for how you tap into that spiritual perspective. So in that moment of talking to the surgeon about where I wanted to go, the tunnel vision was, well, here's a medicine, an enzyme that will help you digest your food. Right choice, right for the moment, perfect Band-Aid. But it didn't get at the bigger picture question I had for him of, my real question was, how do I redirect my life in a way that my body's not fighting against me? So in this question I have with patients that are coming in with anxiety, and I have that same conversation. This is an antidepressant, but it's going to help with your anxiety. I have to pull back the conversation and remind them, this is not your forever pill. This is a Band-Aid to get you in right balance, give you back the energy and the focus so that you can start to turn that ship and get your life pointed in the direction that this pill is not going to fix your life, but it's going to give you agency so that you can start to make hard decisions. Because if you think about what was going on in your life, even around this anxiety, around my pancreatitis, there were some hard decisions that needed to be made, some changes, some belief systems and patterns. But while I'm wrestling with anxiety on a day-to-day basis, I don't have the energy or the capacity to do the other things. It becomes static in my head. And the short-term fix is appropriate to help clear the static. Just don't get dependent on that thing. Let that be a tool in your toolbox to then go and do the rest of the things.
I appreciate that. I think people need to have a large toolbox, but also to recognize that a tool that works for one person may not work for somebody else. And I like the freedom that kind of comes from you get to try it on.
You get to try it on, and you get to pick your tools. And that's where your voice becomes important, because you may say to your provider, you know what? I had this conversation about cholesterol medicine. You know what? I don't want to be on this medicine right now, because I know that once I start, I'll be on it forever. Let me try these. And then I start to contract. We start to negotiate. I'm going to start walking 3 or 6 days a week. That's a big jump, right? 3 days or 6 days. But being realistically, I'm going to set a goal for walking 3 days a week, and I'm going to stop using fast food for breakfast as an option. I'm going to do these 3 things, and then let's check back in 3 months and do something else. Sometimes the threat of a medication motivates you to say, what else can I do? Because I don't want to be on that thing. But you got to have something to counter offer. It can't just be, well, I don't want to be on that medication or any medication at all. I'll just suffer. That shouldn't be your option either, because life is too short for that.
I think you bring up a good point too, in that, sometimes it's just one next right step. It's just one small step. Like you're like, I'm going to give up fast food in the mornings. Like that's enough. Right. Like if your habit is to leave the home 10 minutes early so that you can go through the fast food line, and that's how you get fed in the morning before you go in, and breakfast is important, then that is a shift that may be all you can do at that particular point. I think there's a real value also in seeing what that shift, by making one change, seeing what that shift does just by doing that one thing. Because sometimes when you do multiple things, it can be confusing on what's working, right? But I'm also one of those people that likes to bring up the other side of it, which I'm kind of an all person, all in. Which I know is surprising. But I'm like, okay, I got to do this, and this. I'm going to do it all at once, because I'm kind of like, well, why would I slowly do one and then the other and take several months when I can just do it all at once and just make that change over a week or two, and then see the total impact of what I'm going to do anyway, which is to do it all. And see that collectively. So I do think that there's also a benefit for people to, like, for example, do like vegan. Like I went vegan one time because I was like, somebody was saying that food and what you're putting into your body, which, by the way, I loved meat. And so I was like, I actually went into vegan when I did it for a period of 6 months. I literally went into that with, I'm just going to do this for a week, because I don't think this is like, I don't think this is going to work. And I don't think what people are talking about is actually like a thing. So I'm just going to do it for a week, but it's probably not going to work. Right. And 2 days in, I was mad at the FDA. I was like, oh my gosh, why aren't we talking about this more? Because I felt incredible in 48 hours. And it was really disorienting to be in that space. So then, because I saw such a benefit in 2 days, then I wanted to do all these other things that people were talking about. I wanted to go into meditation every single day for 10 to 15 minutes, because it said it would help me with my focus, decreasing my anxiety, increasing positive emotions. So I wonder if you also see people that kind of do this all in, and do you notice as a practitioner any better results or different results from an all-in versus a gradual approach?
So I am in support of all-in cold turkey for people who that's their disposition. If you are an all-in person, I'm never going to tell you to take one step at a time. If you want to do all the things, do all the things. But for a vast majority of people, changing eating behaviors is more overwhelming than they expect. And it keeps them from making any changes. So I will barter with them and say, what about we do just this one thing? So it's hard to say results, well, like one is better, you get better outcomes than another, because if I give a person who needs baby steps an all-in solution, they might go all in for 21 days and then they'll revert back to their old behavior, and they can't sustain the new change. And so that would look like a failure, because even though they felt better in the first week, they went back in to the old thing and they couldn't maintain the change. So I would rather see you cut back, one soda at a time until you get down to one soda a day, than you to stop drinking all the sodas or all the coffee or all the red meat, and then in a month you're making up for lost time.
So sustainability is what's important, creating that habit, making sure that you can, keep going on whatever it is that you're changing.
Yeah.
And it's not like you don't tend to go back because it just feels like it's too overwhelming to do it all.
Yeah. And so one of the things I was talking about last week was self-awareness as part of this whole journey of being attuned with mind, body, and spirit. You've got to know what your pattern is. And so if I tell you to cut out these 3 things, and from yourself and your habits and your rituals and how long it takes you to change a habit, that you're only going to be able to successfully execute one of those, then you can negotiate that at the table and say, you know what, let me just focus on the red meat right now. And then you create a behavior change that's sustainable, and then you come back to the table again and say, okay, now I want to talk about this. Let me talk about my coffee. Let me talk about my sodas. But I would, or if you're, like I'm more impatient about certain things and I want results now, and I'll get discouraged because I'm not feeling better immediately, and I know this about myself, I might negotiate, no, I just want to cut out all the things because I need to feel better in order to reinforce this new behavior. So figuring out what motivates you, what you can maintain, is part of your self-awareness, and you bringing an offer to the table. That's what healthcare should be. It should be both of us bringing an offer to the table. I'm going to remove this. I'm going to stop doing that. And then the provider says, okay, and I've got this tool that might help you with some of those changes, but we're only going to do it for a little while. Then you have a conversation, a collaboration that's centered on you and how you're setting yourself up for success.
Yeah, 2 things kind of come from that. Number one, I think you're bringing up a really good point to have a good working relationship and a collaborative working relationship with a practitioner. I always say to people around therapists when they're looking for a therapist, and also physicians, it's important to like your physician and to have a good working relationship. If you feel like you have to prove a point and prove your truth and your reality and your preferences and your expectations to that practitioner, that may not be the right person for you, because your voice gets to be the loudest in the room, at least when it comes to your healthcare.
Yeah.
Right?
Yeah. And how this aligns with the theme of your podcast, and like being authentic and finding those click moments and when you're going to make important shifts in your life, is that all of our relationships reflect our relationship with ourselves. So a lot of times we will have an inequitable relationship with a provider because all of our relationships look like that. We've always been submissive to the male figures in our life. We've always been competitive with the female figures in our life. And so if a female provider walks in and gives you a suggestion, you're probably going to respond to her the same way you do habitually the other female relationships in your life. You got to know that about yourself, because someone may be bringing you pearls and nuggets and you're fighting the system because you always fight the system in that similar type of relationship. That comes from self-knowledge, self-awareness. You got to know who you are, what your kryptonite is, and what sets you up for success. So me personally, I always ask for a female physician because my story is that they listen better. Now that doesn't mean I haven't met male physicians who are really, really good listeners and who are really wise and valuable. But for right now, in the place that I'm in, this is what's benefiting me, and it's what's making me feel more empowered as a patient to go in and ask for what I want. Now, I can't leave that there. I got to go in then and remember in all of my relationships to use my voice, whether it's with a male or a female or whatever. I know what my kryptonite is and address it accordingly.
Yes, yeah. Michael Bernard Beckwith talks about how we give so much credibility to physicians, we give so much power, and that if they write a prescription and they have something down, we'll just do it. And he's like, we need to have that awareness that don't disempower ourselves. If somebody says there's no hope, you're giving away your power in that moment, when you might have some agency and ability to move whatever this is in a different direction because you believe that you can. So not to give away that power. I think that's really important. I also think, one of the things that we talked about, and I'd like to kind of go back to is, with the mind, body, spirit piece of this, I look at our bodies and our minds and our spirit as being kind of a secret portal to this authentic version of ourselves. And I think about, like, you can't oftentimes, or I don't want to say you can't, because I certainly think people can, but for myself, my experience is that moment that I started to recognize that I had more power in my life and capacity to pivot and change and impact my health was the moment that I got in connection with the spiritual realm, and I started to shift my relationship with spirit. And once I shifted my relationship with spirit, I realized that spirit was inside me. And when you realize that you have an infinite power from outside you also co-located inside me, that was a moment that it planted a seed of, ooh, what could happen inside me if I was in a trusting relationship and I was listening for my next right step, myself inside, versus necessarily a practitioner. So as a consumer of, and also a practitioner, as a consumer of medical services and sharing your personal story, there was probably this moment where you've also been guided to your right answers inside you and then been in collaboration thereafter, but it was inside you. So can you talk a little bit about that?
Yes. So you see how excited I am about this part right here. There is something I have come to really appreciate in the last year of like my spiritual growth is learning to recognize when I hear truth. I can appreciate that I don't have all the answers. If I go into a mechanic and my car is rumbling, I don't presume to know why my car is rumbling. He's going to give me some options or maybe one finite solution in his mind or her mind of what's wrong with my car. I trust that when I hear truth, I will know it. If I go in arrogantly claiming that I know what's wrong with my car and I have no training and no experience in mechanisms, mechanicry, or whatever you want to call it, the field of mechanics, then I'm doing myself a disservice because now I have tagged in an expert and I'm going in claiming to know more than they do. That happens it happens in doctor's offices, it happens at the auto shop. I don't know why I'm struggling with them. It happens in religion and spiritual circles where you go in and you think that personal authority means ego and you know the answers. What you do know is when something feels right to you. But that's a muscle that has to be built. So if he tells me the carburetor is missing a left lug nut.
Oh God, the mechanics out there are like, that's not even a thing.
Right. I will feel something in my body, and sometimes it's because of a relationship of trust that I built with this person. Sometimes it's because of the way they deliver the message. Sometimes it's because of something else intangible that I trust. Oh, this is true. This person has good intentions with me. That's important to build. You can know your body, and a provider can offer you usually half a dozen different ways to approach that particular condition. Yeah. And you're going to innately know which one is right for you. Okay. Yeah. So if they only give you one solution, then maybe your ask then is, what other options do I have? Sometimes just out of pure efficiency, we'll give, okay, do this. Or out of experience, this has worked 9 out of 10 of the times. But if that doesn't resonate with you and you feel it and you're like, this is a match, this is going to be the path for me, then ask, what are my other options? And then they will reach back in their toolbox and find some other options for you. But You stop when you land on that thing that feels like truth to you. And that's you having that personal authority to choose options and speak your voice and ask for different solutions in this exchange, in this relationship. And I'll bet you, if you haven't done that before, it's going to be really, really hard. If you're used to submitting to what the one thing is that the person says, the authority says that you have to do, and you just always do that, or on the contrast, you always buck authority and resist authority, you can do the same thing in the doctor's office or at the auto shop or wherever you go. So learn to listen for truth when you don't have actual truths and solutions of your own.
So it's interesting. So it kind of sounds like, and I'm just going to repeat this back because I'm not, like, I want to make sure I'm understanding, because we're talking about spirituality.
Mm-hmm.
And you're describing truth in your body
Yes.
as being a spiritual experience.
Yes. Discernment. We hear people talk about discernment in spiritual circles a lot. Truth in your body is discerning what is right and what resonates with your body.
So there's not this universal truth.
Right.
It's not like there's this one right truth.
There's not even a timeless truth. What's true for you today may not be true for you next year.
Yes.
So recognizing this evolution, I think that's what spirituality brings us, is this fluidity and flexibility to be in different truths at different times and allow lots of different things to be true at one time sometimes. Like religion, no, not so much. Here are the rules. But spirituality is, here are a general broad set of rules in 10 different languages, in 10 different formats.
Right.
And one of those is right for you in this moment.
Yeah. And I think we can talk more later about like the many different ways that you cultivate this discernment and this relationship with spiritual energy to get to your own truth, right? Because it's so important when it comes to medical care. I think that's a larger discussion that we can revisit. But you also bring up the emotional piece, right? The mental piece. Because what you talked about is that the same person can have a very different reaction to the same circumstance. So the same physician, different people can walk in and experience them differently based upon their individual experience. And that is an area that we can really like be aware of, so that we can decide for ourselves, is this a part of ourselves that we want to keep as it is? Or is this a part of us that's been cultivated based upon experiences that may not serve us anymore, or may actually be some unhealthy dynamics that are keeping us from being our most well self?
Yeah. And to dig down into that emotional piece and your body's truth, I heard a wise woman say once about discerning whether a reaction is an emotional reaction or if it's a truth. If someone tells you something or offers you something and you feel this tingling in your body, is it anxiety or is it excitement? Really tapping into how your body tells you yes and how it tells you no. If you're not well versed with it, you'll confuse them all and everything will feel like, no, I can't do that. But if you really get comfortable with what your yes feels like, then someone can offer you something that sounds scary or foreign or whatever, but your body's going, oh, yes, that's what I need. Let's do that. Let's do that. You know?
Yes. Yeah. And I want to riff a little on that since you brought it up. But I was in conversation with my friend Eli recently about this, and it was the way that he said it just it resonated with me. So what you referenced with excitement versus anxiety. So our brain emits a chemical, and it's the same chemical. And when it emits this chemical in our body, our mind interprets whether or not it's anxiety or excitement. So it's the same chemical, but a person, and probably perceivably, you know, the same person can at any given time, like you said, it can be depending on who we are and what our circumstances are at any given time, we can interpret that release of that secretion of that chemical as being an anxious moment inside of us or being an exciting moment. But we're the ones who determine what's happening. So it's the exact same circumstance. So what this means is that depending on who we are today, the culmination of experiences that we have that are currently activating us, that changes our experience with this moment. This is where part of, I believe, my work and individuals' work is we have this invitation to be able to be aware that every time that we're aware that something is happening and we're having an experience, we get to ask ourselves, is this true?
Yeah.
And not only is this true, but discerning what really is this that I'm experiencing. And I have more agency, your term, I have more agency over what this moment is. I get to decide what this moment is, and then pull from this toolkit that I'm continuing to evolve and grow, because you won't use all tools at all times in all circumstances. But the bigger your toolkit from a mind, body, and spirit perspective, and the more awareness that we have in our capacity to discern, the more capability we have to take agency over whatever is happening to us, so that we can have an experience that is from this center, this authentic version of ourselves.
Yeah.
Right?
Yeah. And I will put this disclaimer out there. This is not a quick process. This is a new muscle you're building. So it's okay to say, can I just take a pause and think about that? And then you could tap into your body wisdom of if this is the right choice for you and which of those truths really felt well. Because in that process of really digging down into your response and your discernment, you can ask questions like, what is the meaning I'm making of this experience? So here's an example. If you go into an emergency room and you've broken your leg, clearly broken your leg, and they want to put a cast on it, you're probably going to say, yep, that seems right. Let's put a cast on it. You could also choose to go, I'm a failure. I shouldn't have gone skiing. I knew better. I was going too fast. So and so. Like, you could get into a whole and choose, well, no, you probably wouldn't do this with a cast or a broken leg. No, I don't want the treatment because I deserve this. You got to know that that conversation is happening in your head, because sometimes we refuse support, whether it's a conversation or appeal or a referral, because we've made meaning of our current station in life and we are allowing ourselves to suffer or forcing ourselves to suffer. Or we're aligning with all of the people in our family even who have also suffered. I am one of them. We are strong people. We don't need pain medicine. We push through. We don't need anxiety medicine. We're not addicts. I get so many people jump right into the addiction conversation. Oh no, I'm not trying to make you an addict at all. I'm trying to ease your suffering right now. What is your relationship with suffering?
This is a really important conversation that you're bringing up, because people don't even realize that they're doing it.
Yes.
It is so it's so the frame of reference, it's so somebody's reality that you don't even know to question it. Like some of these things that I'm talking about that we gain awareness, but some of these things we don't even know that we're not aware of. Yeah. At the end of my grandmother's life, it became clear that she had this kind of orientation about medicine and had been suffering for a long time, because she thought that that's what she was supposed to do, was that I'm strong enough to withstand this. But she didn't even know to question that. And it was like an aha for me of, oh my gosh, like how many times in my life do I have a frame of reference that is so set that I'm not even open to solutions, and that receptivity and that openness only comes from having a moment in some area of our life that we can generalize to other areas to say, oh, I need to be aware that I can actually have a frame of reference that's so closed that I don't even see a solution when a solution lands in my lap. right?
There are so many hidden truths that we don't question anymore. I'll give you one that I discovered that I'm not that proud of, but I had made the decision somewhere in my mind, probably from relationships and successful people that I've met, that I can either be successful in my career or successful in my relationship,
Oh,
but not both. And so my attention has vacillated between the two, not even considering that I could be happy and thriving in both at the same time.
yes,
Imagine the choices that I've made over the years with that belief system running in the background.
Absolutely.
Unchecked.
Yeah. And I think when you were looking at this holistic mind, body, spirit kind of perspective, I think it's really important to be thinking about how open are we, and then what do we do with that once we like some of you may be listening right now and going, I don't even know what to do with that. Like, how do you, like, by definition, especially in the field, like we talk about denial, when somebody's in denial, to try to make a case to somebody who's in denial about something is futile, because that's the definition of denial. I mean, there's suppression, which means that I once was aware of it and I'm pushing it down. But denial is I have no access to understanding what you're talking about, and I have no identification with it because it is not part of my reality. That is a real thing, right? So it's not denial when we have a frame of reference or a belief system about life. It's not denial per se, but it is a belief system that is so ingrained that it functions almost like denial, in that it's so firmly implanted that it is hard to become aware so that you can actually have a receptivity. So I don't know, do you have any thoughts on that process?
Yeah. I'll go back to the ship analogy. If you're going to change the direction of the ship, you've got to is it the rudder that steers the ship?
You are talking to the wrong person, but that sounds right. We're going to go with rudder.
You got to shift where your GPS is set. And if you recognize you're not headed in the right direction, what will it take to change your trajectory? For me, it started with contemplation. So there's this whole field of contemplative practices where I turn inward and I ask questions. So if I'm in a yoga class, I'm on the mat and I'm doing a certain pose, I'm asking, do my shoulders actually feel comfortable in this? Are they aligned well? I'm starting to ask questions of my body so that I'll know. You know, my hip's not just hurting for the fun of it. It's hurting because it's not aligned. And if I make this one micro adjustment, now I find some ease. So you start to get in right relationship and right alignment with your body by listening to it. That's a contemplative practice. Maybe you're having questions and inquiry with people that you know, but usually people that you don't know, because they're going to insert a different lens than what you're used to. So part of contemplative practices is being surrounded by a community of people, both peers and wise elders who can feed and pour into you, who can help re-steer or I'll lose the ship analogy, who can help redirect the ship. Because you are going to have a harder time doing it on your own. You need to be surrounded with people and practices that will help you shift, because belief systems are so hardwired in us. They take a lot of reprogramming, and you don't want to even attempt to do that. You almost can't. But you don't want to attempt to do that alone. You need community. You need wise counsel. You need it's a new lifestyle that you're adopting. It's not going to be one book that you read. It's not going to be one documentary that you find. It's going to be that and implementation. Learn something, implement it. Do one thing, evaluate it, shift it, make it personal. So it becomes a new lifestyle that you're adopting, and it will feel a little bit like a lonely stretch or an uphill battle, depending on how well supported you are and how many people of like mind you're surrounded with.
Yeah. And I know when you talk about like these do you describe it as 5 pillars of health? And community is one of those pillars.
Yes, one of those pillars.
And I love that point, because it really does take a new mindset, which when we're trying to, a lot of times we think we have to muscle through on our own and we get into our heads and we're trying to discern it on our own. But from my experience, when I need new information, I need new input.
Yeah.
And that new input comes from the connection for me with the divine on what's my intuition saying? What's my intuition saying that I need to do next? And sometimes it's in community, like what you're describing. And I think it's beautiful that you're giving an example. Meditation, sometimes I love meditation, but there's so many different types of meditation. You do not have to just sit there and be silent. That is like advanced player move. You know, you can listen to guided meditations, you can listen to music. There's so many different types of ways, but you're describing yoga, and yoga is a beautiful community, and it is a way to get in touch with mind, body, and spirit all at once.
All at once.
That is an amazing opportunity to cultivate your connection with your body, to start to say, okay, what are my current capabilities?
Yeah.
How could I take agency over my body and make some slight adjustments and notice that the pain is less because of something that I do? How does that recognition of your capacity to make slight micro adjustments then interpret and inform your mind? What else could I do?
Mm-hmm.
What are other ways that it starts to open up and give you a widened perspective. Like one thing can give you a widened perspective and also start to give you this mind, body, spirit connection that you start to say, what else can happen?
What else is possible?
What else is possible?
Yeah.
Right?
Yeah. Community can both support new behaviors and plant seeds for ways of being that you hadn't thought about. But you have to remember that communities are made of humans who are also growing and flawed. And so don't ever just follow any dogma, no matter how flowery the label is. Keep asking questions, keep finding the right fit, keep personalizing it to yourself so that you stay in alignment and in authority of your decisions and your choices on a day-to-day basis. We can go extreme with anything. So don't let community be an excuse for you to be blind again and blindly follow.
Yeah. So as we start to wrap up this topic, I think that's a perfect segue to the importance of what much of these conversations are about, is that it is really important to honor what our personal experiences with our health, to get in touch with our right answers, like that we get to decide for ourselves what feels right. If you try yoga and it doesn't feel like your thing, maybe it's not your thing now, and maybe it's not your thing in general, and that's okay. But the point is to search for your answers, and a wrong answer isn't a wrong answer. It's just a door that you've walked through that you're like, that doesn't work for me, and it gets you closer to the next thing, right? So it's this relationship with trial and error, this willingness to just try something new, but to find your personal answers. And when we get in touch with those personal answers, then we can be better partners with our healthcare providers for our health, because the reality is that we're going to have to live with the outcome. And so, like you said, like when you get into that space, there's these answers that are uniquely yours, right? So is there anything else that you'd like to share with folks as we wrap up on this topic that's been on your heart that you feel is important to touch on at this point?
We've given a lot of examples and information, and my only invitation at this point is to do exactly one of the things that we just said, is to really sit with this conversation and see what it stirs up in you, and then take that one baby step. You don't have to do all the things. You don't have to get to or figure out what the solution or the end result is going to be. What is the right next step for you that you can accomplish right now?
That's wise. All right. Thank you so much for listening in. And I just want to give a shout out to the cover art with Micah Mackenzie, an amazing local artist. I just want to say thank you for that image. Appreciate you. And certainly, if you have interest in participating in comments around this discussion, I would love for you to reach out and put your comments in, and we can start a dialogue around this. So thank you so much for tuning in. And until next time, thank you, my friends.